All right, we're live. Hopefully this wind won't be too bad for you all. It's finally starting to clear up here. It's been ridiculous for the last 4 or 5 days. I was saying to a colleague today, it was like being an episode of Twilight movie. Constantly gray, dark, and rainy for like 4 days straight. All right. So hopefully you guys saw my last video. If not, you can go and click on it. It really was talking about how to differentiate the difference between having back pain and hip pain, and really looking at what the origin of it. And then obviously once you know where it's coming from, the pain that is, you can start to treat it as such. Until then, you're really just shooting at the dark, like when people just go ahead and take an anti-inflammatory like ibuprofen, like, yeah, this will make it feel better, not really understanding where it's coming from, the pain that is. you know the more you know, the better off you'll be. So, and I think my next couple of videos are going to be on the hip specifically. I think I'm going to go back and review snapping hip syndrome a little bit, maybe some osteoarthritis. So I'm going to go ahead and do that. So hopefully look forward to those couple of videos coming, and kind of go from there. If you have any questions, you can always DM me, and I hopefully should get back to you. Let's see. Let's talk about my last episode of walking. I think it's Average Joe walk number 7, number 8. It's got to be somewhere around there. I can't keep track. I probably should. Hey, if someone wants to tell me, that would be great. But hey, look at that blue sky a little bit. Holy cow! Can't believe it. North Carolina. I think I lived in Pennsylvania or something, the way it was been so bad weather-wise. Anyways, I digress. Let's talk about horror stories, because people love to hear horror stories. Maybe I'll just do a whole segment just on storytelling and therapy. Never can tell. All right, so let's talk about horror story number 1. So this wasn't too long ago. I was an outpatient working here in North Carolina, and had a patient come in, seeing them for like 3 months, telling them over and over again, probably like 8 or 10 weeks into it, I was telling them, okay, this is your home program. I think this is about as good as you're going to get. I mean, at least for the short term, if you continue to do these particular exercise and these modifications, you should continue to see some improvement. So, like I said, I've been seeing this person for about 3 months, and just almost solely one-on-one. I wasn't really giving them off to a physical therapist assistant. I mean, they were doing. Let's start from the beginning. They were initially with a rolling walker to get around. Had a lot of leg weakness. Had some back pain, some poor balance, and then endurance and reduced activity kind of falls in line with that stuff. Sorry for the wind. So then we started working on initially figuring out why they were having pain. And of course, it was something as simple as they were just sitting too much, sitting incorrectly, causing a lot of excessive movement in the spine. Here comes more wind. Once we really dialed in and addressed that, everything started to follow once the pain started to reduce. And it was nice she actually stayed on, because a lot of people would have stopped doing therapy. I'm going to give them credit. Or at least they continued with therapy after their pain went away, to really focus on the strengthening component of it, so that you can actually not only continue to get better, but hopefully reduce the risk of this happening to them again. So, got them off the walker, got them onto a cane, all right, And then really in the house, they weren't using the, sorry for the wind, they weren't using the cane at all in the house, just when they went out and about. Got them off of that. And at that point, I'm like, okay, here's a good program to continue with. I would also recommend you go to the gym or the pool 3 times a week, Monday, Wednesday, Friday, and really add a nice walking program in there at least a couple times a week on top of it. So really, excuse me, you're doing something every day. So anyways, ended up being a whole ridiculous situation where she got angry. Husband shows up. He's like trying to talk to her. She literally can't be convinced. She's like, "You're discharging me. You're kicking me out. You know, this and that and the other thing." Just being absolutely nasty when I was like, "Look at it. This is as good as you're going to." I mean, at this point, this isn't any, you don't need a skilled therapist to do this, to pay for, you can't have him pay for this. You know, I mean, I'm not going to commit insurance fraud documentation wise because you want to continue to come to therapy. So then I said, look at here's the discharge paper. Didn't want to sign it. Said they weren't going to sign it. That they were gonna go to human resources and they wanted to know my manager. And I'm like, okay. Well, at the time I was just a clinician. I was in management at all. I'm like, that's fine. Of course, then it was like what 2-3 months later they finally say something to management. And I said, hey, this is what happened. I said, this, you know, nothing, and nothing on me. I mean, I did everything I was supposed to do. So that just shows you, you know, you work hard and how ungrateful people are. You know, it really does put a bad taste in your mouth. And you wonder why, you know, you try not to affect you, but I mean, you're not going to keep doing the same thing over and over again, expect a different result, you know. So, needless to say, that was my nightmare. Just, I mean, my whole day was shit after that, literally, you know. And the husband, I mean, he was a complete rollover. I mean, jeepers, talk about talk about being whooped. He stand up for himself. Give me a break. You know, at that point, you get kind of disgusted. Like, you know, stand up for yourself there, buddy, a little bit. Anyways, you can see how that relationship turned out. Well, that was a horror story for me. Or story number one. Let's see. Because just never know. Oh, here's another horror story. So here I'm a student. So I was a physical therapist student. This was back in 2000, early 2000s. So I was working full time in New York State, in Binghamton, New York, and driving all the way down to New York City every weekend for 3 years, staying down there with strangers. Very nice people, but they would let me stay there. I paid for the weekend, and I'd drive back on Sunday night. And then during the week, I took some time off. So that was one of the craziness. For work full time and then go to school for a doctorate program for 3 years. Insane, but I did it. Anyways, but where was I going with this? Oh yeah. So here I am working up there, and I was a student. So you have to do clinical rotations in the medical field. Physical therapy being, you know, not being any different. So I did one of mine had to do it at a pediatric, so I did it school based. Wonderful therapist who was my clinical manager or my clinical instructor, my CI, and I had to do presentations. You have to do presentations all the time, so you kind of get used to doing them. And so I did one, and I did it. See if I can remember. It's been a long time, but I did it specifically about, obviously kid based and disorders and stuff along that line. So whether it was like cerebral palsy or um, Down syndrome, all those basic ones. Hey, Brown Eye, how you doing? You got back to work yet? So, so I was doing my presentation. Perfect, perfect. I mean, obviously I'm toting myself here a little bit, but tons of research, backed research of what my statements were in regards to cerebral palsy and Down syndrome and mental retardation in kids and all the weird neurological disorders and genetic disorders that kids have. And yeah, I'm back in tender. You mean your back is tender? Or yeah, I'm back in tender. Anyways, um, so yeah, my back went out too a little bit. I did too much this weekend cleaning the cars and stuff, and now I moved just right this morning. My back locked up in one side. I'm like, yeah, that's that old arthritis and that facet joint again. Mm-mm-mm. Yeah, so now I got some intermittent L5S1 issues in my legs, so it'll probably take 5 to 7 days for it to kind of calm down again. Onwards and upwards. As you can see, I'm still out here walking because even though your back hurts a little bit, movement, get that synovial fluid movement in that spine. Static positions do not help your back. Anyways, so I get done with the presentation. Glowing review from my clinical instructor. She thought it was great. And of course, back then, excuse me, and I'm sure it's the same case now, you have to give out like what do you thought questionnaire, almost like a performance questionnaire of what you thought of the presentation. And of course, all those beeping teachers said, "Oh, I didn't understand none of it. It didn't really cater to the audience at all." And I thought to myself, well, if you weren't so stupid, I did cater to you. I did give some basic definitions of everything. You probably just weren't paying attention. Oh, wow, someone's moving. Look at that. U-Haul at your door. Look at that. I'd never even seen that before. It's on pallets now. Huh. Look at that on pallets. Who would have thought? It's a lot cheaper than a truck. I guess they just pick them up and put them on a flatbed, maybe. And off you go down the road. Anyways, so yeah, I was, as you can see, even still today, as you can see today, still kind of irritated by it. Oh well, not really. It was such a long time ago. Jeebers, 20 years ago now. We're pretty close. But anyways, that was just the basic horror story as being a student. But going back to a real horror story, a real one, a real gross one. So this was back in the this might have been like 2001, 2002. I'm working in Binghamton, New York. And at that time, therapy's different then than it is today. 20 years does make a big difference in the presentation of things. But let me get past this car so I don't get run over. So I had a patient, outpatient, and they came in with a leg. We were doing wound care, some basic wound care, and it was on his thigh. And this had to do with a lawnmower accident. So this guy was riding the lawnmower. Somehow he had it rigged up to where when you come off of the seat, it didn't shut off. This was a riding lawnmower. And somehow he got stuck in the ditch, and somehow he got pinned underneath it, and the blade was just chewing up his thigh. So just imagine that you're in a ditch. When you come off the seat, it's supposed to shut off, right? But he had this thing rigged to where it wouldn't shut off, and so that blade was just going around and around, chewing at his thigh. So we were seeing him for, like strengthening and range of motion in his leg and his knee. Because you figure if your entire thigh, your quad, was kind of chewed up and it's healing and scarring, you can imagine it ain't going to bend too well. So they had wound care there. They had a wound care nurse. I don't remember the specifics of it, but he was coming in, a couple times a week. We were seeing the guy, I think, 3 times a week in outpatient. And, we'd seen the guy for a while. I mean, we're talking like months. And this wound site really isn't healing too well, or it's just not doing anything, kind of staying stagnant. So, one visit, the primary therapist that was with the patient, because it wasn't me, I wasn't the primary therapist. Nurse comes in and starts saying, yeah, we need to address this a little bit further. And she starts hacking into this guy. I mean, literally gets the scalpel out and just starts cutting back the skin. Says, oh yeah, that's dead. That's not alive. That's dead. So we got to get all the way back to where there's borders. I mean, she cuts out, I kid you not, it has to be at least the size of my hand. At least the size of my hand she cuts off. So imagine your thigh, right? Cutting the sides of that out, just like not deep, but just superficial, because there literally was coming from the back side. If you looked at the thigh, and literally there was a tunneling, and it was literally part of the skin that was dead. So, hi. So, so they ended up cutting all the way around that, cutting it out, and didn't tell the guy, like, hey, this is what we're gonna have to do. Kind of prepare the person for it. Not preparation at all. I'm trying to think. Obviously this guy was, kind of taken back like anybody would be. Like, holy cow, I never really. The primary therapist ended up seeing him, I think, after that. I don't. I might have seen. I can't remember if I actually saw that guy again or not. It's been such a long time. We're talking 25, almost 25 years ago now. It's a long time. So that was a horror story where you're kind of just like, holy cow. I mean, how do we, if someone else, and in this case it was a wound care nurse, comes in, really doesn't properly introduce what's going to happen treatment wise and why they have to do it a certain way, and then we're taking over. It's kind of like what happened last time when I talked about the chiropractor, where the chiropractor really just went and did something, and then we're coming in after the fact, another discipline, and having to do our evaluation or our treatment. And then they're like, hey, this is what just happened to me. I'm like, yeah. Obviously you're trying to talk up, talk the profession up and stuff. And it's pretty bad when you have to try to explain what someone else should have explained before you actually did the treatment that you ended up doing or implementing. So it's what do they call it? I would call it piss poor carryover is what I would call it. So and then you kind of, and it just, it puts a bad stain on the whole situation, your company, in your profession. So, it's like, yeah, this is what had to happen, or this whole blameless apology you end up having to do, you know, even though it wasn't, you had nothing to do with it at all, but you're just trying to salvage the situation. It had to be done. It just didn't have to be done in that fashion. That's the difference between being tactful, really, knowing knowing the person and how they're going to respond because you've been working with them a while, versus someone that ain't got a clue what's going on. So it happens. It's probably a better view. My arms get tired. Your arms get tired. My arms get tired. Got the little gun still. Not like they used to be. Getting old. Trying to stay in shape. Everybody should try and stay in shape. All right. That's horror story number 2. Horror story number 3. This is even a better one. I mean, what can top that, right? Well, what tops this one is when you have to pick up someone else's caseload because they call in sick, and no one notifies the patient that they're going to see somebody else. So they show up and they're pissed. Because, like, hey, who are you? I wasn't told I was going to see you today. Hi! I wasn't told I was going to see you today. So right off the bat, it's like, okay, you got to try and salvage the situation. This was probably 15 years ago now. Yeah, how about that? Somewhere around there, 15 years ago. So, worked at a place where someone calls out sick, you have to try and pick up some other caseload. So, you're seeing your own caseload, plus you have to try and see their caseload too, which I think is absolutely ludicrous, but it's the reason why I left that rat race, and they give you some crazy slogan, some justification, like, oh yeah, they still need to be treated, and the medical doctors plan of care that you sent to them said that they were going to be seen so many times a week, and you think the patient's going to get better if they don't receive the treatment, and all this kind of nonsense, this blah 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 blah. And really, you're seeing 3 other people at the same time, and they're not getting the care they deserve or what they're actually paid for that visit. I mean, you try to do the best you can, but at the end of the day, it's not possible. It just ain't happening. So, needless to say, like, it's one of my videos I did here not too long ago where the do's and don'ts of therapy. Like, if you go into a clinic, number 1 to get out is if you go there and the staff say, oh yeah, come on back, and you go back there and the place is absolutely packed. And you're like, what the heck? They tell, oh yeah, get on the bike. And you're like, what am I going on the bike for? Oh, just to warm up. And then, you're seeing them for your neck because you got neck pain. Like, what am I going on the bike for? you know, some wacky justification of like, oh yeah, we're gonna go ahead and warm up the tissues first, and there's more benefit to that than there is, just we need to work on the posture and the alignment. Oh yeah, I know all the lingo, I know all the hoopla, all the blah blah blah. The reality is they got too many people, or excuse me, too many patients for too little stints. Trying to work on 3 people at one time. Come on, really? That's the reason why the insurance companies have cracked down so hard over the last 10 years, 5 to 10 years, is because of that nonsense. You're paying a therapist, let's say $45 an hour at the most. Of course, you got their benefits on top of that. And you figure you got to bill out. You can't bill out 1 for 1. How are you going to do that, right? Keep the lights on and pay for pay for your secretary, and try and get a little bit of ching ching on the side. That's how they do it. They got those two other people at the same time. That's all extra cash flow right there. That's where that mindset comes from. Hey, don't get me wrong, you have to make money. Otherwise you're going out of business real fast. Really? 3, 4 people an hour, every 15 minutes. Or sometimes they double that. Sometimes 6 people an hour. That's just stupid. So if you see anything like that, just leave. You're not getting the quality care that you should get. So, guys out mowing his lawn. Everybody's mowing their lawn now that the rain stopped. Anyway, so yeah, that's horse story number 3. So hopefully you guys liked that last video and a couple videos before that. Like I said, if you have any questions, you go ahead and just shout it out, and hopefully I'll get to it. I should be able to. All right. Until next time. Look up. Woo! There's no bias. Keep smiling. See you next time, folks.